So this next section is dealing with experimental versus non-experimental research. Up to this point, we spent a lot of time talking about experimental research. But it's important to have the distinction between the two when performing research as well as when you're reading research. So an important distinction when doing research is related to in kinesiology and nutrition and the health sciences in general is that between experimental and non-experimental research. For example, experimental research involves the manipulation of some variables in the study. For example, you're doing a training program, the effects of a certain amount of resistance training or duration of aerobic exercise on, let's say, aerobic capacity or heart rate or muscle gain, or it could be diet. You may be manipulating a particular amount of protein content or carbohydrate content, and you're trying to manipulate that to provide some type of evidence that the treatment caused something to happen. So whether in diet, it might be weight loss, in training, it might be an increase in muscle mass or an increase in aerobic capacity. So that's when you're experimenting, experimental research, when you're actually manipulating some type of variable to determine the outcome if that manipulation had an effect that you hypothesize it may or may not have. Well, contrast that to a non-experimental research, which simply just observes a phenomenon as they occur without any manipulation of the variables by the researcher. So for example, the individual, you might be observing children at play, just measuring how many minutes the child in the classroom is up and moving, or you might observe children in diet, for example, just simply observing how much certain foods that they eat, but you're logging them, you're recording them, but you're not having any type of direct contact or manipulating any type of variables to influence that individual's behavior. So let's move on to an example of experimental research versus non-experimental research. Well, here's an example where using the same squat as your measures between experimental and non-experimental. So here in the experimental, the researcher decides that group A will perform safe squats on Monday and Thursdays at 10 a.m. and group B will perform back squats on Mondays and Thursdays at 11 a.m. Both will use the same linear periodization, so the same exercise protocol as outlined here as follows. So this is what they're going to be doing. So what's happened in experimental, you have two distinct groups that have been randomized. Group A does the back squats. Group B will do, Group A does the safe squats and Group B will do the back squats. The idea is that now you have two distinct groups that the researcher has randomly assigned, and you're trying to then determine the effects of these different research or different squats on the outcomes of strength and hypertrophy or muscle growth. We'll contrast this to a non-experimental approach where a researcher assesses strength and power in football players and asks them to report how they train in the squat. But the researcher does not advise them on how to squat. In other words, the researcher would just simply observe those football players who are doing back squats and observe those individuals that are doing safe squats. They are self-choosing which type of squat that they would like to do. Their investigator did not randomly assign them. So you're just simply watching and observing and recording what will happen based on what the individual has chosen to do. So very distinct differences, whereas again, experimental, the researcher is really manipulating the protocol, what the subjects and participants will do, very clear cut on what they should do, whereas in the non-experimental, the individual will choose which one, and the researcher will simply observe and log the outcome. So let's talk about a summary of the non-experimental designs. Now, when you're doing your project, most individuals will choose, and it's more interesting to choose the experimental design. It's more interesting, I think, and it's more in-depth. It allows you to do some of the fine-tuning and understanding as a research proposal. However, it's important to understand the non-experimental designs and some of the terms you may hear. The first is the causal comparative, also known as a retrospective cohort study. It's an example where researchers look into the past to determine potential causes for current conditions. So, for example, individuals, they are determined if they smoked maybe 15, 10, 5 years ago, and determine what their health is today. So you're looking at retrospectively, looking at what might have what they did in the past and how it might be affecting them today. The other is a survey where researchers identifies a sample of a large population and collects data from them through a questionnaire, which is very common for them to use, or results, and then the results are generalized to the population the sample came from. So for example, if you decide that you want to survey a group of SIUE students about their feelings about class sizes at SIUE, you decide to use a survey, a small sample size, and then disseminate that to a larger group. Now, a census is where you're using research to collect data from an entire population. So, for example, the U.S. Census is probably the most notable one that we're familiar with, where you collect data from every American if possible. The pros of that is that you have every single individual in the population that has been sampled. The difficulty with that is the amount of cost and time to sample every single individual in your population. Usually it's not very realistic. Another census example is, let's say, along the feeling of class sizes, you decide to sample every single student at SIUE. Again, time and cost are things that you would need to consider. Longitudinal is a type of research where a researcher collects data from the participants at multiple time points to examine trends in the data. An example of this would be the Framingham study, which is looking over a 30-year period about the effects just following these individuals over a 30-year period. And every so often, every few years, they're tested for multiple health outcomes. And then you find out based on what they are doing in terms of the amount of exercise and diet and how that may have an effect on their overall health. But it's longitudinal, it's over a long period of time, and data collection is done at multiple time points. The other one is correlational research. It's where the researcher is interested in the strength of the relationship between two or more quantitative variables. We're trying to determine how much one aspect may affect another. So, these are very important in terms of determining an impact that one thing may have on another. So this is just a short summary of the difference between experimental and non-experimental designs. We're going to go into more detail, and especially with the experimental design as we move forward in this class. So make sure you look over this section, have a good understanding between the two, and then we'll move forward with a little more detail about experimental research.